Morning, Volusia County. The other day on Facebook, I asked you to send me questions to ask the experts, and you definitely didn't disappoint us. We got over 750 questions and comments. A lot of them hit on the same issues: testing, closing the beach, stay-at-home order. A lot has happened in the past couple days to answer those questions, and I really appreciate you taking the time to participate. This panel here has a lot of valuable time, and their time is valuable, I should say, and they're here today to try to get as much information as we can out to our community so that you can make informed decisions about you and your family's health. I think it's important to remember, as you hear these experts talk about different things that are going on in Volusia County, we cannot let panic and fear cancel out common sense. So I'm proud to introduce our panel today. A good friend of ours, Dr. Margaret Crossman, the Chief Medical Officer for Halifax Health. For the Volusia County Sheriff's Office family, Dr. Crossman was one of the first people on scene when she was off duty, her and her husband, to help out Frank Schofield during his tragic bike accident. On behalf of the Volusia County Sheriff's Office, thank you so much for what you did for Frank and his family that day.
Thank you.
Also, Dr. Joe Smith, Chief Medical Officer at AdventHealth. Holly Smith, Communications Manager with the Florida Department of Health. Our County Manager, probably the hardest working person in this room, George Recktenwald. And Dave Ottati, the Regional CEO from AdventHealth. So thank you for being here. So we're not going to waste any time. We're going to get right into it. County Manager's got a lot to do today. George, the first question comes from Karen Sullivan. Is there a list available of what are considered essential businesses?
Yes. You can find it in several places. You can go to our website and click on, and they'll give you from the governor's orders. But it comes from the Homeland Security. The governor didn't reinvent the wheel. He went with what Homeland Security had put out. He did tie in also, if you want to do even a little bit more internet time that maybe all of you have, he also tied it in with the Miami-Dade ordinances. So you have, if you really want a complete list, you got to look at both of them. But essentially, what that does is it ties into essential activities, and it's a pretty broad range, you know, things like healthcare, public health, law enforcement, food, agriculture, energy, but also things which you wouldn't maybe think, but you would appreciate: water, wastewater, anybody working in critical manufacturing, defense industries, hygiene products, services, so your grocery stores, your drug stores, those type of things, they're all considered essential.
If did you guys post the order online?
Yes, you can go to our website at volusia.org and the emergency management website. So both of them you can get and get a quick look. If you have any other questions, I know a lot of the cities, I talk to the city managers regularly. If you live in a city, many of them are offering the ability to call the city hall, and their attorneys may help you with any kind of questions, especially like if you're a small businessman and you're wanting to know, well, does my business apply? Because a lot of these people really want to do the right thing as well. And also you can do that in the county through calling the County Economic Development Department, which is 1-800-554-3801, and you can talk to them as well if you have any question.
Well, you bring up a good point. If our residents have questions, we opened our CIC center is now open.
That's correct. The CIC is also open here, and I can get you that number probably at the close of this. Okay.
And to follow up on what George said, if you go to Emergency Management's website, if you go to the county's website, or even if you go to the Sheriff's Office website, the order's posted. To save you a lot of time, scroll down to page 24. Page 24 is the Miami-Dade, and what basically tells you what essential businesses are, and then from there you can get a feel of the direction that you're going to go.
That's right.
The next question, George, comes from Melody Fish, but it already talks about why the beaches are open, but can you reinforce what the beaches closed mean?
Yeah, that's a great question. Yesterday I emphasized it a little bit in the press conference, but when we say the beach is closed, that means it is closed right now. We do not want people out on the sand at this time. We're trying to work in conjunction with the governor's order. We're in a period of time where we're before the surge here in this county that's expected. I think it's very important that people realize that it is a time to stay home. So when we saying this, it's closed, we mean do not go out and walk on the beach right now. We mean that there will be no lifeguards out on the beach. We mean that there'll be no services open at the beach. There'll be no bathrooms, no parking. All that is shut down right now with the intended purpose of people need to go home. If you're here from out of town, you will not be able to use the beach at this time.
So surfing, kayaking in the ocean are no-no.
Unless you can get out there through another means, through the inlet, boating is allowed. If you can get out singular away from people, that's fine. If you want to swim in the intercoastal or other places like that, that's still allowed. That is still considered exercise generally by yourself, not in a gym, but exercise out in the outdoors is considered an essential activity. But if you're out there, we don't want you coming in on the sand, so you need to be using the inlet and rivers and other things. In Volusia County, we have an award-winning trail program. We have, some of the best trails in the state. We encourage you to get out on those as well.
Boat ramps?
Boat ramps will remain open. But we are watching these things, and again, if people do not follow social distancing, we have the ability to watch those ramps, and we will enforce social distancing.
Dave?
Yeah, Sheriff, I think that's an incredibly important part here that you're bringing up. I know sometimes some people think that's a decision that's unpopular. Other folks think it should have happened a while ago. When you take a look at a recent New York Times study, it will tell you that Volusia has many folks still traveling all the way around. And it's one of the counties that needs to enforce this much harder than anybody else. They named actually Volusia, they named Jacksonville, they named Tampa as 3 areas that are continuing to socialize in a greater capacity, to the point that I think even in Jacksonville recently, the sheriff had to break up some things as well that were happening, block parties. I think it's incredibly important that we go out and make sure we enforce this because all the models that we have seen will continue to increase the amount of folks infected in this community, and we just really need to hamper down on that component.
Well, Dave, you bring up a great point, and I know the manager's got to run, but what are we looking at? I mean, people look and say, yeah, the numbers are going up, but it's only 2 deaths. I mean, it's 2 lives, and you're only saying it's only 2 deaths. If we fail to do the right thing at this stage of the game, what could we potentially be looking at?
You could potentially be looking at, according to the CDC models and what Dr. Fauci puts out, somewhere in the neighborhood of nationally 100,000 to 200,000 deaths. When you break that down on a county-by-county level, if we don't put these measures in place, you're talking 2 to 5 people per day per county. Those are lives that we can save, Sheriff, by continuing to exercise good hand hygiene, social distancing, following the guidelines of the CDC, your primary care physician, and the healthcare professionals in your community. It's going to be up to us, Sheriff, to determine how bad this is going to hit us. And the closer we adhere to those recommendations and those guidelines, the safer we all are, and the more we can push those numbers down towards 0.
Dave, I thank you so much for bringing that up because I've gotten a few emails about, hey, I live in a gated community, and this weekend our pool's closed, but we're going to have a block party. But we'll practice social distancing of about 300 of us in a parking lot. And I got to tell you, folks, you got to be a real knucklehead to want to do that after what you're listening to what the medical professionals are saying.
The gate won't stop a virus.
The gate, that's perfect. That's what I tell people about my badge and gun. They say, well, your deputies are different. No, we're not. We can't wave our badge and gun at the virus and say, don't infect us.
That's right.
Yeah, I truly appreciate that. I think we're going to have to clamp down harder and harder, in my opinion. I think you look at every single one of the models. All of the models have us ramping up. I don't have any one of them that has us ramping down anytime soon. And most of them having us hitting a peak in early May. So it's not the next week or 2 weeks. It's May before we start hitting peaks. And hopefully that's, there's always some variation in the different models, but so far all the models are showing that. And it could be wrong, but you want to make sure that you follow the best judgments that are out there. And I think we need to really take this and enforce this across the board. It's not just a matter of 6 feet distance and so forth, but what you touch, where you go, everything from the gas station to your clothes going into the house to every aspect of this that we're going to have to really look at. I mean, it just, sometimes I walk in and like, I'm uncomfortable in certain areas in today's environment. It's not my nature to be uncomfortable, but in today's environment, we're hampering down all of our hospitals, all of our teams, in this and clamping down pretty tight today. And we would advocate that across the community.
George, I know you gotta get moving. Real quick, this question is from Brittany Seitz. Will Volusia be receiving rent mortgage leniency like in other counties?
Yes, we're going to have a couple of programs that are available. These programs include Volusia County Community Assistance Division, where people who have been impacted by the coronavirus through loss of employment, that we're able to provide up to $2,000 in rent and utility assistance to qualified individuals. We're also using what we commonly call SHIP funds, the State Housing Initiatives Partnership Program. These funds will be available in certain areas of the county. The cities, some of the cities use their own SHIP funds. So I think for people, the best advice is to call our Community Assistance Division at 386-239-7757. And again, we'll do the best we can to help, and I'm sure there'll be other programs forthcoming.
Part of her second question is, and I guess this would go to the health department as well, will grocery stores be limited to 30% capacity? That was something that was passed in Seminole County.
Yeah, and I think Seminole County might be backing off of that. I don't know that for sure, but we have nothing like that planned at this time. I think it's important that I want the message that people will be able to get food. And really the distancing that needs to occur there is use the day, you know, and work as a team, and don't go at the most popular times. Think about it, make some decisions, make a list so that when you go, you're not loitering around, get in and get out. I know some grocery stores have talked about maybe creating a one-way movement through the store. That may be advisable. I know a lot of the grocery stores have already marked off 6-foot increments at the line. Even if they haven't, this is where people need to take a little self-responsibility and take a minute and think. And you know, you could step up close and then realize, oh, I made it, and get back. People sometimes get a little shy. They don't want to say get back. So take that self-responsibility, be extra courteous. I've seen some really nice things that have occurred. I've seen people in the parking lot assisting an elderly person and saying, hey, you know, maybe it's best I go in and do that for you. Acts of kindness like that, I think we need a lot more of to get people through this. But certainly a grocery store, I would use, rather than the 30% occupancy, I would try to space the day. And so that you use the whole day, and therefore you can get in there when it's a little less crowded.
You bring up a great point about looking out for your neighbors, and also the hoarding issue. I mean, come on, folks. If you look at the order that the governor put down, there's really nothing that's closed that affects your life. I mean, essential lifestyle, you know, you don't need to go in and clean toilet paper off the shelves anymore. Take your time, get back to your normal routine as much as you can. Right. Going out and hoarding stuff is it's horrible to be doing that. There's no reason for it.
Yeah, correct. And that's why I think sometimes too is do a little planning. You know, we've got into a lifestyle through the years. I know a lot of people that, you know, we don't plan dinner, you don't plan those things out, because we've had that ability to just go and do what we want. A lot of this just means taking a few minutes, thinking about it. And I do encourage those that, you know, to support the local establishments where you can get takeout. Just do it safely. That doesn't mean hang out inside waiting for the takeout. It means get the takeout, order it, and get it, and get out of there. And again, that helps out some of our businesses during this tough time. So you can support them as well. But I would be watching to make sure that they're making and taking the right precautions as well.
This question is for everybody. It comes from Mary Kitchens. Do our city and county healthcare workers have enough supplies? So Holly, you want to take a gander at first, and we'll ask Dr. Crossman?
Well, the Florida Department of Health works with the hospitals and long-term care facilities on making sure that they have the PPE or the protective equipment that they need to care for their patients and protect themselves. the emergency management here at Volusia County also is assisting other medical type personnel with that, and George can talk a little bit about the very well-stocked and well-coordinated warehouse that they have.
Yeah, we've used a section of of our Ocean Center, Convention Center right now is a point so that suppliers have an easy place to get in and get out of. And we coordinate with all the medical agencies. Again, through emergency management, we're able to put in orders through the state government and make sure that everybody has what we need. So we've been supplying the cities, of course the county, and we've worked with the hospitals and healthcare facilities on whatever need. And if there is a need out there, again, they can contact us here at Emergency Management, and we'll take care and do the best we can.
Great. Doctors, I'll throw that to you, because last
Sure.
night in Walmart, as I was in their shop, and they rolled out a couple cases of Lysol spray. And of course, it was like moths to a flame. And one of the women was yelling, "I need one of those cans. My daughter works in an ER, and they have no disinfectant." And I kind of like looked at her and was wondering, is she saying that to get a can, or is that true?
Yeah, as far as what we're experiencing at Halifax, we have adequate supplies for our needs right now. There are a lot of people who want to use the N95 masks, and some in situations that they really don't need them right at this time, because this is all about the contact and droplet precautions for the most part, eye shields when you're engaging patients who may be under investigation for COVID. It is, as we discussed yesterday, when you're going in for certain procedures that you need that special filter mask, the N95. But in lieu of that, in general, you're typically okay with just the regular masks. So there is currently, when you're trying to balance and keep people from feeling they need to use all their equipment all of the time, their protective equipment all of the time, there's this balance that you run to try to be a good steward of the supplies that you have. So we have come close on a couple of our supplies. The ones that we get a little close on would be our N95s and our shields. I think we've gotten the message out there. There was a little bit of a conflict between what World Health Organization said and CDC advised, and so that's where a lot of the mixed messages were coming from, as well as from the front lines of healthcare facilities that were struggling in the heat of their hot zones. So as we've settled that out among our staff and they understand what they should and should not need, I think we're doing well. But again, N95s, we watch that supply every day. The face shields, masks, we watch that supply every day. We have already started building up our supplies of additional masks. We've got orders out for the masks that we need to have come in, but we do, as I have said, have an army of sewers, seamstresses in the community who are using the pattern that is a UF-based pattern for recreating or creating these N95s or the equivalent of that using a certain type of material. And so we're doing everything we can to plan for, as we talked about earlier, should we see that increase, that spike, and find that all of a sudden we're going through our protective equipment more so, that we'll have opportunities to continue protecting our staff despite increased use that's going to happen that we anticipate.
How about AdventHealth, Doctor?
Yeah, at AdventHealth, we absolutely have adequate supplies to make sure that our teams and that the patients they're taking care of are safe. I think part of the confusion that has arisen is that we are trying to be very good stewards and not waste that material. And so when we're very deliberate about, what we use, where we're following the CDC guidelines about how those assets are deployed. AdventHealth has a global purchasing effort in place to bring in supplies to make sure that we're able to meet any surge above and beyond even what the projections are. And we're making sure that nationally we're all cooperating so that our different markets and campuses can share those supplies as needed to respond to surges that may happen asymmetrically throughout the country. But I think the overarching message is, yes, we're being careful with our supplies, and that, yes, we have adequate supplies of disinfectants, masks, gowns, all the materials you need to safely care for patients in this environment.
Yeah, I don't think what people understand from our perspective of running an organization is if you put that stuff out in the open shelves, it's gone.
Just like the Lysol.
Exactly. You have to lock it down and make sure, like all of our stuff in the sheriff's office goes through inventory supply. So if a deputy needs a mask, if he or she needs hand sanitizer or whatever, they have to go to inventory supply so we can
That's
ration
right.
it out. But speaking of supplies, Dave, you know, Dr. Crossman talked about it yesterday, and I really saw it today. People out riding their bikes, people food shopping, people going for a walk wearing masks now. Is that
Yeah.
something you guys would recommend?
You want to, go ahead.
You know, I think, I don't think there's a silver bullet, okay? And I think if you live in a congested urban area, probably stay in your house as much as you can. If you live in, you know, more rural Volusia County, there's no reason why you can't be out on your property kind of by yourself, getting some exercise, keeping your spirits up. There's nothing wrong with that. I think that the overarching message is maintain your social distancing, maintain your hand hygiene discipline, not touching your face. As you said, try to cooperate with your neighbors. If you can go shopping for more than one person and do that at an off-peak time, that's fantastic. That's the kind of stuff we need to be doing. I think, you know, the idea of a bunch of people getting into a gym together right now is a really bad idea. But we do want everybody to stay mentally healthy, and part of that is, you know, get a little sunlight, and that might be in your driveway. That's okay too. There are all sorts of exercises you can do without leaving your home.
Yeah,
And I would add that if we just look at our mask as an additional measure, because we can't leave behind the
Right.
social distancing and all the other things that are so important, the hand sanitizing, the hand washing. And so if the masks create a false sense of security, it's going to work against us.
That's true.
If we handle our mask after touching coming in contact with surfaces, it's going to work against us. So it's just an additional measure, but we cannot forget those foundational things of watch the surfaces, hand washing, keep some distance. And at a time when coughs, colds, other little reasons, allergies included, are creating runny noses and slight little coughs, it's the right thing to do to cover your cough. So if you're in those public places, having a mask on will help you not leave your droplets, which may or may not be infected, into the environment and create problems on our surfaces that we're concerned about.
Holly? Oh, go ahead, Dave.
I would add to that too. I appreciate that. I think there's a component of this that a lot of folks say, but I feel well, I'm doing good, I don't have any symptoms.
Mhm.
But so far, the research that I've read says that there's at least 25% of the folks that may have it that are asymptomatic. They don't have any symptoms, and yet they're passing it along to others.
Right.
So you got to be cautious. The mask is not just for others, but it's also for yourself too. And I know, you know, as we continue to evolve here, I think it's becoming a really good idea to just be cautious, watch where you're going, watch what you're touching, and also, and if you're in any type of groups, actually start wearing masks as myself. So.
Well, speaking of masks, I guess the big question we constantly get hit with, Holly, is test kits.
Yes.
And Travis or Tracy Culver asks, are test kits available in Volusia County, and if so, where?
I think she's asking, where can I get tested? That's a very common question, and it's not a real quick answer, so I'll try to summarize it for you. So a few weeks back, the Florida Department of Health worked with commercial laboratories to open up testing to increase the availability or the capacity of the system to test people. Prior to that, it was being done by the Department of Health and hospitals for a very specific high-risk group. So now with the commercial labs online, any physician or facility like an urgent care facility can collect samples from a patient who meets CDC criteria and then ship those samples to a commercial lab for testing. So that's the addition to the system. If a provider isn't able to collect the specimens in their office, they can arrange for that to be done either at an urgent care or somewhere. Hospitals also can test, but hospitals are only for people who are really severe with shortness of breath, and I think Dr. Crossman and Dr. Smith will probably talk about that a little bit. The Department of Health does testing, but we are only doing very specific high-risk people. So the CDC, Centers for Disease Control and Prevention, we're throwing that acronym around a lot, has very specific criteria for DOH, for hospitals, and for providers. And the first criteria that has to be met to get tested is symptoms. Someone has to have symptoms. We're hearing a lot of people want to be tested if they're asymptomatic just to know if they've been exposed, and I'm sure we'll get to that question in a little bit of why that's not being done. But right now, if you meet that criteria, meaning you're symptomatic and you're in one of the other criteria that the CDC has set aside, you can go to a provider or an urgent care center to be tested through one of those systems.
To follow up on that, I don't really know a lot of this, but this point of care testing that they're talking about with this new technology that's coming out where you could be tested and in 20 minutes get the results, what do we see? What's the future hold with that?
Sure. So there's a lot of really rapid research happening and a lot of tests coming to the forefront. Not as much validated as they would otherwise have been typically, but this is a pandemic situation, so there's a lot coming to the forefront. We have 2 tests, and actually several, but the 2 main ones coming to the forefront are a PCR, polymerase chain reaction test, and that's the one that is best at detecting presence of the virus. In other words, if you are infectious or have the virus in your system. The other one is an immunoassay, and that just tests for have you been exposed to the virus, as evidenced by your immune response is now able to be detected in this study. So the best test for determining if you're infectious will, of course, be the first test, the PCR. And that one is showing pretty good sensitivity, in other words, the ability to pick up the virus if it's there. But if it's the first day or so, if your viral load, in other words, is very low, say under 70 to 100, then it's possible that that will be negative and a falsely negative test result. That can happen in the first day or so of having been exposed. We don't know exactly how long that will be, and it's different for different people depending on how rapidly that virus replicates in their system. So there is a window where you can have false negatives. So especially if you're without symptoms, the likelihood of that would be a little greater. But now there is a time to use that and rule out that you have that virus in your system. For instance, if you had an exposure a week or so ago and you have been quarantined and just making sure that you did not develop symptoms, and now it's time to return to work, and because of the nature of your work, you're in that category where perhaps a negative test would be very helpful. That PCR then could be very helpful in that regard. The other test, the immunoassay that tests to see if you have been exposed, can help, number one, test that, but certainly determine if you are in that window where you have some immune protection. And it's kind of exciting because that's the test that will probably move to the forefront as we're talking about some of the experimental treatments where you can use someone's immune response, their plasma from their body where they have all these immune response and antibodies, and use that to help someone who's struggling with the actual disease. So there's a place for all the tests, but it's all about doing the right test at the right time and not being falsely reassured by having negative tests. The only other place would be for epidemiologic studies, which is something we'd love to do if we could, and we do have some going on. But if we wanted to do a prevalence test and just find out if we test everybody, how much virus can we find in our communities, that will be nice to do at some point in time, and also where we need to focus our isolation or our quarantines, if you will, restrictions of movement for those that may be carrying this virus. So there's a lot out there about testing, but those are the 2 main ones to keep in mind and keep your eye on.
Dr. Smith, what's
Yeah.
the criteria? I mean, that's I think
Sure.
the big question is people say, why can't I get tested, or when should I
Right.
get tested?
No, that's a great question. So, and let me just take a moment and recognize a lot of us are very visible. First responders, healthcare workers, our Department of Health. There is an army out there of researchers at universities across the planet who are working day and night to increase our capacity to test for this. And they're really kind of unsung heroes in this because they're the ones that are going to arm us with the tools we
Amen.
need. So everybody out there, thank your local university staff and laboratory workers. The reason why we can't test the whole planet, and that's that gets asked, right, is right, this virus was essentially unknown 3 months ago, right? So there was no test, there's no stock of tests for this that were just sort of sitting out there ready. So that's been developed and deployed in record time throughout the planet. If you are asymptomatic, you need to do 2 things. One, you need to continue to follow all those guidelines we were talking about, and you need to assume that either you could infect others or that you could be infected by somebody that's also asymptomatic or who is symptomatic, right? So you're going to nothing changes for you based on the test if you don't have symptoms. If you do have symptoms, you need to call your primary care physician or you need to go to your local Centricare, and we will evaluate you and apply those CDC criteria to make sure that you're tested in a very timely fashion. We absolutely have enough tests for that, as well as rapid testing available for the acutely sick patients in our hospitals.
Great. That is, I think that hits the nail on the head. Holly, we keep getting asked about, will Volusia County have drive-up testing? I mean, that is asked all the time. I mean, where
Every
do you think
day.
we're gonna see that?
Every day. Currently, there are no drive-up testing sites. There may be, private providers may choose to do that in the future. I don't see that on the radar at the moment. Currently, testing is available. We still have the resources to test, again, through providers. And at this point, the government agencies are not planning a drive-up because we still have the capability locally to do it through the original channels.
Okay, so there's the answer right there. The next question is that, I don't even want to read it because it's kind of just a handle, but.
Dominus ominous.
Why are households being monitored? What does this mean?
Yes, so because you're putting out the data once a day, twice a day now, that's
Yep.
total, it's cases and monitored. So I want to explain what that means, just kind of run through a scenario.
First of all, could you also let people know, because one of the things we get every night when I put that out is, this isn't accurate. Is the information you're supplying us accurate?
The information that you are getting is coming from us locally, and it is a snapshot of that moment of the people who are either isolated at home because they're positive or because they're a close contact and being monitored. Now, those numbers will change because as they're cleared or as more come on, the numbers go up and down. Back to the question of what is being monitored, I'm going to just run through a quick scenario. Let's say I test positive today. The Department of Health is going to call me up and say, Holly, you tested positive, and they're going to go through a whole list of things that I need to do to keep from infecting others. And the main thing is going to be, you're staying home until we tell you you're cleared. Quarantine is the term that people use. Then they get into a long history with me to find out where have I been since I first had symptoms. It's going to be over, the last 14 days or so. And they're going to want to know who I was in close contact with. Not did I go to the mall and walk through, it's who was I spending prolonged time around. So if I tested positive tomorrow, you all would be on my list. And what the Department of Health does is get your names and your contacts, and then they're going to call you. And they're going to call and say, Mike, George, bless you.
I don't want to say that.
Spray them down.
Let's get him a mask. All of you have been exposed to someone who tested positive for the coronavirus. Here's what we need you to do to prevent the spread. XYZ, by the way, you're all staying home for 14 days. We need you to monitor for symptoms. We need you to take your temperature twice a day. If it's elevated, call us immediately. In addition to that, someone from the health department will call each of you, including me, every day to check up on you. And if we determine that you meet criteria, you have a fever, one of our nurses comes to where you are, meaning your home, wherever it is that you're self-isolated, and tests you right there. That test goes off because they're symptomatic and they meet criteria because they're a close contact of someone who was positive. If their test comes back positive, we say, George, your test came back positive. Where have you been for the past 14 days? And George is going to say, you had me at home locked down. And then that's good because then his list of contacts is smaller. But if there were some days, if he tests early, then we go to that ring of people and then lock them down. So that's the contact tracing and the isolation piece that's to prevent the spread of the people at highest risk. So that's what does monitoring mean? And was there a second part to that question?
Yeah,
Or?
the second part to it was, why would they simply not be tested
Yes.
to confirm status?
So they find out today that I'm positive, they're all asymptomatic, and it goes back to what Dr. Crossman was saying is the efficacy of a test that's performed on someone who's asymptomatic. The swab that they put up your nose may not pick up enough virus or any virus that would create your test to be positive. So if we tested George today and George test comes back and says he's negative and we let George loose, George could still come down with the virus and develop symptoms over the next 14 days, and he's out in the meantime infecting everyone else. So that is why, unless they become symptomatic, they're still on lockdown for the entire incubation period. But unless they're tested, does that make?
Just thanks for picking on George. Dave, you wanna add to that?
Well,
Yeah.
So far, he's clear.
I would
I
add,
could possibly use the 14, but I think to what the doctor said earlier, with some of the advancement in testing in some of those scenarios, that's where some of this could help down the road in that when you're a potential exposure and you've exceeded the time, enough time so you would definitely be self-quarantining for a period of time. That time might get shortened if you were able to get the test after 24 or 36 hours, so there's time for it to grow, but maybe not out on the 14th day. We may be able to shorten some
To
of
do
the
it sooner.
time if you have that test. somewhere in that middle.
When there's enough virus to be
Right.
detectable, right?
Exactly.
Or antibody.
Yeah, so Holly's spot on. When you take a look at multiple countries and what's transpired, in many countries it's still ramping up. The few countries that we've seen that curve come back down have taken those exact steps. Let's take South Korea, for instance. Within a first week of them understanding that they had a virus, they started mass production. By week 2, they had over 100,000 tests being produced a week. Then they started mass testing of populations, was their second step. The third step is they started the quarantine process, and they started monitoring every person's place. They actually, through your cell phone usage, they can tell where you're going. They would quarantine you and track you all the way through and make sure that you're contained so that you're not spreading it. And the fourth step they took is they enlisted the entire public and said, please help us. If you see folks going out there, please help us enforce this. And with those 4 steps they took, the mass production, the heavy testing, the very strong quarantine, and then this enlisting of the public's help, they were actually able to curve that rate. And today you're like, wow, how do we get there? And I think those are things that we're still trying to figure out. We're still trying to figure out that mass production. How do we get that going? I mean, right now we have limited production. We're doing it in the hospitals to some limited degree. We're doing it on the public to some limited degree if you just have certain symptoms, right? We haven't gotten to that mass production yet. The quarantine, we need to make sure that's enforced. We need folks to listen to that, to adhere to it. And then we just need to enlist the entire public's help in actually enforcing that. And I think if you do those things, we have the ability to curb that.
And public health, everybody looks to the health department as the one who does public health. It's a community-wide, public health is a response from the hospitals, from law enforcement, from our county partners, from individuals. They need to be responsible and help us prevent the spread by taking those mitigative or preventive actions of hand hygiene and social distancing and all the other guidance that may come out later today from the CDC.
Dave, you brought up a great point. I don't sleep much at night, and I watched the replay of PBS NewsHour, and they featured Taiwan and their CDC. Having gone through SARS, they were so well prepared when they had, I think, 8 or 10 flights a day from Wuhan into Taiwan. And they did everything you just said went on in South Korea is what Taiwan did, and I think they have barely any cases of COVID-19 over there, which I thought was...
Japan, South
pretty
Korea,
amazing.
Singapore, a number of those countries, they were able to curve it very quickly because they got on top of it very quickly. And we're still struggling to get on top of our counties and our state. A lot more orders coming out, and I appreciate that. And I know, again, it's for many people that's unpopular because you're like, okay, what's the count today? What's transpiring? But what the count today, I mean, just realize that our testing is, there's a lag in the symptoms, there's a lag in the testing, so by the time you actually start seeing the numbers, these things could have happened 2-3 weeks before. So we're always looking in the rear view window going, what happened 3 weeks before is what the decisions we're making today.
Yeah, I just hope that Volusia County residents, as they're watching this, and as America sees what's going on, this is really a test of our character as Americans. And I think we really need to remember that when you're holding these block parties, you're figuring, I don't have to follow anything that these people are telling us. And Holly, it brings me to a point, and I discuss this with Andrew Gann all the time. How many people have been diagnosed with COVID-19 who are now back in society?
So what we call that at the Department of Health here in Volusia County is how many cases do we have who are cleared. So with the example, if I'm a positive case one day and the Department of Health is contacting me every day, they're going to be looking for my symptoms and looking for the day when it's been 24 hours when I didn't have a fever any longer. And that means without taking Tylenol or anything to lower my fever, it's a natural reduction of 24 hours of a fever or more. And then they say, okay, you've lost your fever for 24 hours. We're going to come out, coming to you and going to test you at your home because you need to have 2 consecutive negative tests before you're cleared. So they come, they sample, it comes back the next day, 24 hours later. If it's negative, they repeat the test. If that one comes back negative, that person is cleared. If the first test comes back negative and the second one comes back positive because it detected the virus that the first one missed, you're still on quarantine and we start over it. You need to have 2 consecutive negative tests. That's how you become cleared. For a very small subset, there also is a way to be cleared that's with time-based from various, and it's probably too much to get into that doesn't involve testing, but with both of those ways combined here in Volusia as of yesterday. I don't have the numbers as of now because we are getting the test around the clock, and I just didn't have time to pull them this morning.
Right.
But as of yesterday, between test-based and non-test-based clearances, there have been 8 in Volusia County. And today, that could be, depending on how many double negatives come back today, those numbers can, just
So Kevin Merkel, who asked this question, the answer would be 8.
8
is what
as
we're
of
saying
yesterday. I don't
as
have
of
today's yet,
yesterday. Okay.
yes.
But Sheriff, and David and Holly touched on this, there's a temporal nature to this that just can't be accelerated, right? If 14 days is 14 days, no matter how hard we work on it. So, and the point I think that we all need to take from this is there are things you can do now that will help that data come in positively in the next 14 days, 3 weeks, 3 months from now, right? And that's what we need to be focused on, is what we can do today.
Great points.
And one more thing is, if I'm positive and I, come down, obviously have symptoms because I've been tested, it may take me 14 days to clear, or it may take me 6 weeks or so. It depends. My body's different. If George gets it, he may be cleared long before I was, even though he tested positive after me. So there's no time frame that someone gets cleared. It's really based on viral load or symptomology and other factors.
Great. I really appreciate that. That's outstanding, the answer there. And this one is one I get all the time. Nate Monk asked, a lot of people are using gloves in our stores around Volusia County. Can we talk a little bit about cross-contamination and point people back to washing their hands? And that's one of your questions coming your way, with soap, water, or hand sanitizer.
So I think that people putting gloves on thinking that then protects them. All that is a covering over your hands, and guess what? You can't sanitize them now. So gloves will still pick up virus, still transfer virus. We hope you're not touching your face if you have gloves on, but you are touching other things and potentially transferring virus to those things, which you may later pick up with a bare hand. In the healthcare setting, if they're going to wear gloves, they sanitize before they put them on. They carefully take them off without spreading the virus, and then they sanitize their hands again. So you're not getting out of the need to sanitize your hands by wearing gloves. And also in the healthcare setting, they're wearing them for a purpose, a finite use, and then they take them off. They're not putting them on in the morning and going to the store and going to the gas station and spreading things all around and then taking them off later. So it is not a substitute. Hand sanitizing should be done with alcohol-based hand sanitizer, a minimum of 60% alcohol according to the CDC, or hand washing. That is excellent advice for any disease that you can pick up, any virus or bacteria.
A dirty glove is at least as bad, if not worse, than a dirty hand. And I think that can't be overstated enough. Also, we've been asked, can you put on gloves in the morning, wear them all day, and sanitize the gloves? Without knowing the product information for every glove, it is entirely likely that the material used to sanitize those gloves is going to break down the integrity of the glove anyway. So gloves are they have specific applications where they might be useful, but the idea that you could put on gloves in the morning and not get this by the evening just doesn't fly.
Same as the mask, right?
Same as the mask.
Sneezing in your mask,
Same as the
you might as well
mask.
throw it away. Why continue to wear it, right?
Yeah, sneezing with a mask on, that at least is going to keep you from putting droplets into the community, so that would be okay.
Doctors, we got some questions for you. The first one's from Jennifer Petrowski. I keep hearing how heat and sunlight kills the virus. What about the cold? Mostly concerned about bringing home groceries. Having been wiping everything down, stuff that can sit in the garage without getting damaged can stay there for a while. But what about putting away cold stuff?
Yeah, I appreciate that question, and I think it's on everyone's mind. Wipe down what you can, but get the cold stuff in the fridge, because it's probably worse to leave it out and let it get contaminated or ruined in some way. The key is that when you pull those things out of the refrigerator, because we talked about how long the virus can live on certain surfaces, again, there's a lot of factors, but let's say it's a plastic container that you put in the refrigerator holding something that you got from the grocery store. It can live for up to 3 days or so on a plastic container. So assume that. Make sure that when you pull it out, that you clean your hands, and then when you open it up, maybe wash your hands before you begin to come in contact or handle what's inside that plastic package. So just think about sanitizing, washing. Assume that whatever you brought in from the outside could have been contaminated.
You hammered that home yesterday, you both did, about it lives longer, the virus lives longer on plastic than any other material.
Yeah, and I think it's important to think about your mail and packages you have delivered,
Yeah.
other things you're bringing into your home. You want to treat those like somebody may
That's
have
a great
coughed
point.
onto them.
Yeah.
And then, we've been asked about UV light and sunlight. When we talk about UV light and sunlight killing the virus, we're talking about on a surface. And I smile a little bit, but it's a reasonable question to a non-medical professional. You don't clear the virus by going and laying in a tanning bed, for instance, or being out in the sunlight. That's not how that works. But a surface that is exposed to sunlight or UV light, that will actually destroy the virus more quickly than something that's in a shaded area. So that's what that's about.
The packages, you're just fascinated by saying that, because on my way here, there was like 15 Amazon trucks
Yeah.
driving down the street, and I wouldn't think of, you order something and there's a package on your doorstep.
You want to try to just be very, very aware of your hands. Everything you touch that you bring into your home, you want to kind of isolate it. Make sure that you're treating that as though it might be the thing bringing this virus into your home.
Right, that's great advice. Kaylee McComber asks us, is it true that medical treatment for malaria is working on patients? I know someone in Atlanta currently recovering from a bad case of COVID-19 and was using the malaria treatment has been the key to them.
Sure. This is part of I'm going to call it a COVID cocktail. So the malaria treatment, people know it as Plaquenil. It's chloroquine or hydroxychloroquine, which is a less toxic form of the chloroquine, one that we use more commonly. It's not only used for treating malaria or preventing malaria when you travel to another country, but it's also something that we've used in our rheumatologic disorders, our autoimmune disorders like rheumatoid arthritis and lupus. So it's got a lot of interesting traits to this medication. Not only what we think is that it helps decrease the virus's ability to replicate, but the other interesting thing about this drug is it helps with an aggressive or over-aggressive immune reaction, because we know the part of this disease when someone gets into trouble, that 5% that gets into trouble and gets a really serious respiratory syndrome with this, part of that problem that they have is an overly aggressive immune response. It's actually destructive. We call it a cytokine storm. And so perhaps that's one of the mechanisms. We're really not sure, but it seems to be helping. And if you add the azithromycin to it, which is another antibiotic, it seems the two together have some synergism that are very helpful. It's not a one bullet for all, but it has seemed very helpful. The other things are, I'm seeing more zinc being used in those cases. And vitamin C was popular for a little while. I'm not seeing as much of that. But yes, this old malaria drug, this old rheumatic drug, if you will, that's not very expensive, is really doing some good work out there.
Have we used it in
We haven't
Volusia
used it in Volusia County at AdventHealth, and it's an interesting question, right? Because just like we talked about the test, the data on this is still coming in. Most of the supportive data is for the hydroxychloroquine and azithromycin combination is out of a very small study, about 20 patients in France. That study showed very good results. A somewhat larger study, 30 patients in China, pretty equivocal. And so what we're getting now is a lot of anecdotal data, seem to work here, seem to work there. We're still kind of compiling that. I think, the jury's still out on as to whether or not that's going to become the gold standard. The FDA has approved hydroxychloroquine for use in this. There's some really important stuff though that people need to know. You don't need to start taking this now to stop yourself from getting it. It's very, very important. It's still very investigational, and it's not something that we should be using as a preventative measure. That's all the things we've been talking about. You should not look for this product in other items. And there's a couple, I don't even want to, but it was a cleaning product that contained this compound, and a couple ingested it, became very sick, and one of them died. And so, there's no reason for you to go out and try to find hydroxychloroquine. If you're in the hospital acutely ill, that is something that we can try if it is appropriate for you.
Doctor,
Yes,
you
and
indicated you
just
guys may have used it.
We have used it in our containment unit, and we're seeing some success. It's not the one bullet for all, and we have had 2 patients who we did treat with it who have gone home at this point. And I concur, and I'm glad you emphasized that, because you don't want to just try to start these things. Really, as I said, it has something to do with the anti-inflammatory piece, the antimicrobial, and only if you're getting into that 5% of population who seem to have that more complicated respiratory distress syndrome. So it's not that, that you need to be trying to do it in advance or get on it just to prevent yourself from getting it.
And these medications themselves are not a free lunch, so to speak, right? They do both have a relatively small, but there's a well-described cardiac risk to both of these. And so you'd want to be screened in advance for something called a prolonged QT before you start these. So it's really important to follow the recommendations of your physician.
Great advice. Let's see what we got here is from Eric Riley. If you catch COVID-19 and recover, can you catch it again? First question.
Do you want to take that one? Either one?
So again, small data sets, what's coming out of China. And so like Holly had talked about, to clear it takes some time. So we're really just now able to look at that first cohort of patients that have contracted this, recovered, and then subsequently cleared the virus. The number of patients that have reinfected, based on what I've seen so far, is a very small number, something like 3%, 5%. And I'm talking about in Wuhan, China, where this was endemic, right? So the best data that we have right now shows that the vast majority of patients who get this and clear it do not reinfect.
Yeah, and I will add to that, some of that data indicated that maybe it was that secondary cytokine storm that they were actually seeing, and just more of a continuation in that worsening that happens in that small subsect. So we're really not sure, but we think that the immunity, and that's where some of the treatments, the experimental treatments and the research around that is that your immune system kicks in at about the 3 to 6 week mark. You may have the most protective antibody at that point in time. That may not last though, so that's where we'd get that plasma to do those experimental treatments. We hope to learn more about that, but beyond that, we anticipate that those antibodies will begin to die back down. And the other factor is this COVID virus, as we've talked about, the little enzyme that's responsible for causing it to replicate and duplicate itself, does some crazy things, and so it's changed a little, and the strain we're playing with today may not be the strain we have next year when this comes around, so we have to keep that in mind. The good news is some people will likely retain some memory in their immune system, not that it would be out there in a big antibody response that's just constantly floating around in the plasma, but a little bit of memory tucked away that perhaps will have some cross-reactivity and provide some protection if you're faced with something similar to what we're seeing right now. But we don't know, that's the bottom line, and a lot of research wrapping around this to help us get those answers.
Dave, second part of that question is AdventHealth ready if that curve continues to jump dramatically?
That's an excellent question, and thank you. There's several components to that. Are we ready? The first thing for me is making sure that we plan correctly. So we're working very diligently on what that plan looks like. Again, the social aspects of this and trying to bend that curve as early as possible is huge for us, because it will depend on how many patients may end up with COVID-19 and end up in our organizations, and depending on that, will depend on the amount of resources that we need. So the first thing is planning, and if it's mild, this is one component. If it's medium in our community, it's a different one, and if it's critical, if we get to a huge amount of folks being infected, that's a different number, if you will, altogether. So we're working through those different stages and having different plans for each one of those stages. So the planning aspect is one issue. The second piece is our team, making sure that we have the right teams, that we're keeping our teams safe, making sure that they have the right equipment, make sure our doctors, our staff, our community, our first responders, all the folks that will be required to handle this are we keeping them safe. And that's why we've implemented many different policies already, like the no visitor policy with certain exceptions and other components to it. Testing of everybody that's coming into our doors are now being tested with temperature checks and other folks. And we're just implementing more and more things because we want to make sure that our teams are safe as well, not only here, but also in their households and so forth. And then the third thing that we've touched a lot about is the resources. And we, 2 months ago, when you said PPE, most folks are like, what's that? Today they can describe every aspect of which one's critical, which one's not, which one I'm hoarding, which one's, it's just a whole different.
N95 is a household word.
I need one, it's like everybody, so you end up with that component. The resources is a big issue. So we're looking through that piece and saying, what are the resources that we have currently? Ventilators, anesthesia machines, all of our rooms, cohort units. You're seeing all kinds of aspects. And again, if it's mild, we have one plan. If it's medium, it's a different plan. If it's critical, it's a different plan. And that's why it's just so important to curve that, because when you get to that critical stage, I mean, we'll have all hands on deck everywhere trying to do our best, and that's very critical. And then the fourth thing would be the actual operationalizing of our plans. And so we're working through 4 different steps on that, all concurrently, to be able to be ready. And I would tell you that our team is working a tremendous amount of hours at AdventHealth and Halifax, I'm assuming as well, to make sure that we're as ready as can be. But each one of those plans require a different set of labor and resources and operationalizing that could really tax our healthcare system.
Dr. Crossman, Halifax?
Yes, I agree with everything that you've said. We've got a task force that is staying focused, looking at and trying to project and watch the projections that are happening, making sure that we're following that along and preparing, keeping our storehouse up, making sure everybody's on the same page with what they need to use of that PPE and what they don't need to use of that PPE right now, and what some of the plan Bs and Cs might be should we need them.
Last question for you is, as this unprecedented crisis unfolds, what has it made the hospitals and healthcare and medical folks readjust their paradigm and say we need to be going in a different direction? What are some of the things that you're seeing?
Telehealth. So telehealth is something that I think everybody has to some extent, but this has greatly expanded our telehealth options. We started with our outpatient practices and really expanded it into them. We knew that it was very important for patients to be able to see and access their physicians and also to get guidance, decompress all the calls into the health department and into the emergency departments. And so getting our primary care offices back up and running in that capacity has been wonderful. Also internally, looking into some of the different telehealth expansions of what we currently have, so that if we have those contingency plans, right, and you have a handful of intensivists trying to help give guidance into the care and of the vent management specifically for multiple patients, it's going to be helpful to have it where they can access in more remotely and give that guidance. So telehealth has been one of the big things for Halifax.
I think for AdventHealth, telehealth, also a big learning. I think we were already, as a company, on a journey to think about how we can bring healthcare to people outside of a hospital, right? How do we provide community access points outside of an emergency room or a hospital for patients? And if anything, this pandemic has really validated for me the strategic vision of AdventHealth, and I think that we will probably see that accelerate even more. We will, I think, years hence, right, we will look back on this and say, wow, we really kind of used a hospital for everything. Thank goodness we have these new access points, primary care, urgent care, mobile testing, so on and so forth. I think will be the legacy of COVID-19.
David?
Yeah, there's a bunch of stuff that's transpiring through here, interestingly. I mean, as this has evolved, we have started a website, all the symptoms and so forth that we're getting. We have had to shut down a number of our departments to be prepared, and we've redeployed that team into a call center. So we have a call center, the 1877 Virus HQ, and we're now receiving over 1,000 calls a day with people with questions related to symptoms, what do I have, all these items. And we're directing that, giving answers, also directing it to our e-care system, which now went over 9 states. And we're now seeing a tremendous amount of folks using our e-care system as well, which is part of the telehealth medicine aspect. We had that deployed, but now we're rolling it quicker than what we've ever rolled it out before. We've got the telehealth medicine that we've rolled out. We've got the foundation aspects. We've got donations coming in, and we truly appreciate the donations of equipment, PPE, other items that folks have, and we're starting to receive that. What's interesting also about PPE is we used to order it and it used to come, and we didn't necessarily pay a lot of attention to where it was being made and manufactured. And as this has become a big issue, we're now looking at where is it being manufactured, how do we change some of that in the future, what's our reserve capabilities, how do we increase that so that hopefully this will never happen again, but if it did, we wouldn't be relying on sources that might be using it for their own need at that time, and we can use it for our needs as well. So from a company perspective, we're actually AdventHealth, we're covering 9 states, we have 50 hospitals, and we're looking at things just all the way across the board on how do we do that differently. Also, how do we shift labor to where these places are going? So So as one state might get hit harder in one location, how do we shift labor there? And then as another state and area is getting hit harder, how do we shift it back over here so that we start allocating resources and supplies, as Joe mentioned earlier, across multiple different dynamics that we haven't necessarily done this intense before. So we're looking at that. Our innovation lab has been interesting to see. We're now 3D printing face shields.
Wow.
You know, it's just interesting. We're 3D
Right.
printing other components. And, you know, we've got a whole innovation lab of doctors and teams that are like, wow, how do we provide solutions? And we're seeing that come out, which has been interesting methodology. So there's a whole bunch of other stuff that we're seeing coming through here that is innovative that we're seeing accelerate. And
Yeah.
telehealth is one of them too.
Yeah,
So
absolutely.
Yeah.
Well, from the health department's perspective, we're also seeing shifting some of our services to teleservices as well, because while we've turned the boat a little bit into COVID and reassigned staff, we still have to provide those essential services. There's STD and tuberculosis and HIV screenings and treatments that need to still be provided. Our WIC programs still need provided. So we have to figure out a way to provide those while social distancing, while redirecting staff to work on COVID as well. So it's the same thing, just different services that the hospitals are doing. But another thing that I think has been really interesting is I think we're learning a lot about each other. We learn not only limitations, but capabilities of our partners, and how can I help you, how can you help us? County government, same thing. Social services, same thing. So it's helping us to learn what we really do have and how we can use that in a different way. It's not a hurricane,
Right.
but yet
Right.
we still need to pull together
Right.
to respond.
George?
Yeah, I think our use of bringing in the dispatch area with nurse triage and some of the higher levels, again, being able to use our resources properly. We've actually seen a decrease in the use of transport, which is, I think, a good sign showing that people are being good stewards of the resources out there, and they're working with us in dispatch to get people really to the resources they need and not clog up the emergency system. I think that's been a big success. Some of the other things David had said, you know, we saw some of this in the hurricanes that covered the entire state, and every community was depending on the same suppliers and contractors, and they failed because of that. So we have to look at how we diversify our supply chain so that we're not dependent on an area that may be experiencing the issue. And so those are things that we are learning and implementing, along with all the other technology improvements that were spoken of.
Great answer. Holly, I got a question for me and you. I think, is there any criminal offense that individuals will face if they have been ordered to quarantine or self-isolate but do not? So I'll let you explain your portion of it and then.
Well, there's different, so there's, if you're a positive test, yes, we can quarantine you, and then we work with you in enforcing that if it's violated. I think it's also come up with the people who are coming through the airport or other ways from those endemic areas, such as New York, Louisiana, New Jersey, I think is on the list. Those, it's a second-degree felony, also with a $500 fine or both. And we use law enforcement to reinforce that as well. But back to one of the comments was made, and it might have been you or David, who said that we need to hear those things from the community because we can't be everywhere all the time. And the community is calling us, and I know they're calling you because we're working together, telling us about people who are supposed to be self-isolated or quarantined, and they're not. So, you know, maybe you could.
That was the second part of the question, so that you
Yeah.
notify law enforcement, notify you.
Yep.
And then you'll conduct the investigation, and based on that, we'll go to a judge and get an order that that person could be taken into custody and forced to quarantine is basically the answer
In other words, there's
Okay.
some teeth.
to that question. There is. And we would hope you wouldn't have to do it. We would hope that people would take personal responsibility and say, hey, I need to protect myself and my family and my community, but
And for our positive cases, that's the indication that we're seeing is people are being responsible for those that, you know, the ones that we're calling every day and those who are under the close contact, you know, monitoring phase.
I have a question from Crescinda Mann. Have you seen an uptick in crimes? And if so, what is the trend? Obviously, we have not. Thank God, crime has actually dropped. Calls for service is down roughly 15% as of yesterday. We did an analysis. One of the things that we are seeing, which is a little disturbing, is since school has closed, we have locked up 25 first-time offender juveniles out between the hours of midnight and 4 a.m. and they're committing felonies. They're committing car breaks, they're committing burglaries, they're committing grand theft auto, and they're committing crimes of violence with a weapon in one case. So my message to the parents is, you have two options here. You can raise your kid, or you can let me raise your kid. And if I raise your kid, I can guarantee you, you're not gonna like it. So that's where we're seeing there. The other thing we saw this week was domestic violence in Deltona. The first 2 weeks, it was kind of at a low point. Last week, we had 15 cases of domestic violence. And I think that as this goes on, unfortunately, I think that is something that we're gonna see uptick because the abuser really has his family in isolation. You know, there's really no outlet here. He's not going to work or she's not going to work. So, you know, we need to look out for our neighbors in that case because we still do our job every day, day in and day out. And the last part of that question was about criminals prematurely being released across the nation. There's reality and there's practicality to that. And working closely with George and our jail, and George, please jump in here, you know, we have about 1,300 prisoners in the county jail. Even though they've been arrested and sentenced or are awaiting trial, they still have rights and they still need to be protected. So we need to be careful of what's going into the jail that would infect that population. My hope is that the serious offenders, they're not letting loose. George?
Yeah, that's correct. You know, when you hear that, these are usually minor offenses, and we also in the jail use the system for isolation. So, you know, right now, things that they may have been able to do, exercise yard, these type of things, of course, they're not doing that, but also where they're housed in the jail. And we have a very robust medical element in the jail. So we're very confident this time, but it's very important that we keep it that way because that is a very enclosed, obviously, population that we need to be take care of, and that is correct. And especially the jail portion of it. Remember, these people do have rights because they have not necessarily been convicted of anything, and so we have to be very careful of that as well.
And to follow up on your point, there are some things that are just unexcusable. You know, a person who commits vehicular homicide and kills a mother and her 7-year-old, and then walks out the door on $500 bail, pays $500 and walks out the door. Somehow I think there was something grossly wrong with that. George, the next question comes from Barbara Wilson, and it's about first responders and protective equipment gear. For the sheriff's office, I can tell you every single deputy has what's called a PPE kit, personal protective gear kit. They have a mask, they were given sanitizer, and we have stuff in stock. We received today, I think, 165 N95 masks and more hand sanitizer. So we are in good shape right now, and how about the rest of?
Yes, right now we're in very good shape, and also we work not only for the county fire and EMS, but we work with the cities to ensure that they have what they need, and right now we're in very good shape.
And my last question is, will deputies be compensated for hazard pay for putting their lives on the line each and every day as they serve amongst the public population during this pandemic? And the answer is the same for first responders as it is for the medical profession. We opted to take this job because of love of our community and to do things better and make things better. So no, we don't get hazard pay. Second part of the question is, I supported my union in a letter that went up to the governor asking that any first responder that would be infected would get workers' compensation or be declared a workers' compensation or injured on duty, much like if they fell and broke their arm. The governor sent back to me, or not the governor, but his staff responded back to us, and under the healthcare laws, there is a provision in there that deals specifically with first responders and the benefits that they would receive if they would come in contact with that, with the COVID-19. George, the county manager, I know, and I'll let him elucidate on this a little further, has put something in place for every county employee. God forbid, should they be infected? And George, I'll let you.
Well, right. Well, it's actually also part of a federal act, in that, yes, that we have extra leave that has been provided for that use, and we will enact that and use that. There's been some expansion to the Family Medical Leave Act. Parts of that we will definitely be using as well. And then on top of that, as this progresses, we have the ability to look at adding more elements to leave as things going on. You know, our goal is obviously to protect our very valuable workforce and take care of them, and we will do that.
I can tell the community at every phone call or every meeting that I have had with George, the health and welfare of the workforce, he has always put above everything that we're trying to do. So it's a pleasure to work with somebody who realizes that and wants to protect us. I have 2 questions from the News Journal. You may have got these yesterday, so I don't want to get the News Journal mad at me, so we'll ask you. Doctors, this one is for you. Can one of the doctors please clarify for the audience what doctors use UV light for in dealing with the novel coronavirus? What amount is needed to clean surfaces? What that same amount of UV lighting might do to human skin? What effect temperature UV raised or does the sun have once someone contracts the virus? I think you touched on some of that, but
Yeah.
you want me to do a question by question? It's kind of a lot there. Or do you
Well,
think you got it?
Yeah, I think we did touch on it, but there are protocols now where you can put a mask or a stethoscope or some other instrument under a UV lamp, and prolonged exposure to UV rays actually will damage the RNA of this virus, much in the way that if the human skin question, much in the way it will damage your DNA and cause skin cancer if you were to lay under it for the same amount of time. So I think the question really kind of presupposes that maybe you could expose a person to UV light, and that is not the case. We use the UV light in a prolonged protocol to sterilize instruments and inanimate objects.
And then I guess the other part of it was UV rays and or the sun what effect does it have on someone once they contract the virus? I guess you're saying, can you lay out in the sun, it'll help cure you?
No, it won't help you in that regard. It might make you feel better and a better emotion and all of that may be good. And that's part of trying to keep yourself healthy and your immune system healthy and functioning well, is getting outside and having that. But it is not going to impact a virus that's already in the cells of your body and beginning to replicate. So it's not going to help in that regard. And for those sterilization processes and procedures, the equipment is left in the room, the people are out of the room while this is happening.
Perfect. George, the last question is yours about the curfew. Do you want to handle that one about
Yeah,
why
sure.
there's no curfew?
Yeah, and you and I have talked extensively about that. And actually, I see that the city of Daytona had gone back in a different direction. It's just not needed at this time. And it could be a little bit of an overreach. Having curfews takes resources. Really, and again, these are pretty unprecedented times, but we've really shut down most of the reasons you would be out anyway. So at the end of the day, if you're out, you still may be questioned. We have not set a curfew time. I believe, and as the sheriff and I have talked, if we were to get in a situation where we felt that it was necessary, we would definitely bring that forward and put it in place. It does disturb me to hear, and I think that should, again, I'll reiterate what the sheriff said for parents, and that they need to know where their families are at. They should know that anyway, and people need to be home. A lot of good Netflix shows and things on. They need to, or whatever it is they need to do, but they do not need to be running around at night.
One of the things also is the governor's safer at home order is a 24-hour order.
Right.
Which really kind of null
Kind
voids
of
the
makes a little
curfew.
bit null and void. I mean, but again, I think if we had a very specific situation, we could do that. And we have in the past during hurricanes and other things of that nature.
Dave?
Yeah, I mean, when you take a look at it, I think today we have already 30 states that have issued stay-at-home orders. So there's a reason why there's this many states that are already issuing these orders. And as George said, there's no reason to be out and about. Everything's closed, during these times. And it's safer to just be at home and be self-contained today.
Yeah.
And help the community so we can curb this pandemic.
I want to thank this group. I mean, every time I sit down with you folks, I learn more and more and more. I'm so blessed to work with such a great group of people. I'd like to give you the final word. We'll do ladies first. Doctor, final word?
No, just stay home, stay safe, and stay connected.
Holly?
Take a role by washing your hands, keeping yourself distanced, stay home unless you have to go out.
Dave?
Thank you. Thank you for the education that you're providing this community. Thank you for doing this today. Thank you for continuing to post different aspects to our community, keeping them educated. And thank you for the work that you're doing, all the first responders. I mean, that's a tremendous amount of work, also our medical community. Thank you for the docs, the nurses, the staff. And then again, there's a whole bunch of unsung heroes, as Joe mentioned. There's universities, there's labs, there's other folks that have made major donations. The CDC, thank you for the work that you guys have done. This will require a huge team effort from everybody working together to do this. And I truly appreciate the work that you're doing and taking this very seriously.
Thank you guys. Dr. Joe?
I want to say that we are ready. We are ready to take care of you should you need us, and that we just ask that you continue to do your part in this fight out there, and that is to follow those recommendations. Stay out of crowds. Keep your hands clean. Don't touch your face. Cover your mouth when you cough. And please listen to your physicians and to your community healthcare leaders.
George?
Just everyone can be assured of the county's commitment, my commitment to continue to provide the essential services that are necessary every day for our standard of living, to be able to be safe. And also, most of all, my commitment to working with this team and everybody that's here. Will stay in constant contact. And I've seen the power many times of us working through in this county, many disasters. And while this is a little bit different than what we've had, a lot of the same principles apply, and we will, I'm very confident with the people that we have, we're going to get through this. And I want people to remain positive.
I hope we meant our goal of this roundtable was to get as much information out there as possible to help you keep yourself and your family safe. But I would like to share something, because I truly believe in my heart that what we're going through right now in Volusia County and America is a test of American character, and it really is going to say a lot about us on what we do in the future weeks that are coming. You know, George, I'll tell you, the other night I couldn't sleep, and I watched an old movie that I really enjoy. It's called The Wind and the Lion. And in that movie, the person who's playing President Teddy Roosevelt is asked a question about American character. And his answer was that the American grizzly bear, in his opinion, is symbolized what American character was all about: ferocity, strength, and intelligence. Sometimes a little blind, sometimes a little reckless, but always courageous beyond a doubt. And I think that's the motto, that we have to be courageous beyond a doubt as we face what we look into forward. And again, may God bless each and every one of you and your families for watching us today, and may God bless and keep guiding this great nation. Thank you very much.
Amen.